What began as a small dermatology practice in Southern California eventually grew into something far larger than anyone could have predicted. Dr. Sandra Lee, widely recognized for transforming dermatological procedures into globally watched content, built a career that blended medicine, media, and public fascination. Millions came to know her through her precise, calm approach to skin extractions and scar treatments, while others saw her as a comforting authority in a field often associated with embarrassment and insecurity. Over time, her work expanded into television, skincare products, and a digital presence measured in billions of views. Yet beneath this success was a relentless pace that rarely slowed down. One day, while everything appeared to be functioning as usual inside her busy clinic, an invisible shift began in her body that would soon challenge not only her career, but the very stability of the life she had carefully constructed. An ordinary clinic day that turned unusual without warning at her Upland clinic. The environment was familiar, cameras positioned for filming, patients arriving with hope and anxiety, and a team accustomed to the intensity of production days. Dr. Lee moved through her schedule with her usual composure, performing procedures that required precision and emotional steadiness. But during what seemed like a routine day, subtle changes began to surface. A sudden wave of heat passed through her body, followed by a sense of mental fog that was difficult to explain. She continued working, attributing the sensations to stress or perhaps hormonal changes. Even as she completed procedures, something felt slightly disconnected. Her body was signaling discomfort, but her focus remained locked on her patients. In environments like hers, pushing through fatigue was not unusual. Yet this moment carried something different beneath the surface, a quiet disruption that did not match the expectations of an ordinary day in a highly controlled clinical setting. Symptoms that deepened beyond what could be ignored after finishing work. She traveled to her parents' home nearby, expecting rest to restore her sense of normalcy. Instead, her symptoms intensified in ways that became harder to dismiss. A sharp pain began radiating through her leg, followed by an unsettling lack of coordination while walking. Each step down the stairs felt slightly misaligned, as though her body was not responding with its usual precision. Sleep did not bring relief that night. Instead, it deepened her unease. By morning, new symptoms emerged that were impossible to ignore. Weakness in her left hand appeared suddenly, reducing her control over even simple movements. Speech became less clear, words forming in a way that felt unfamiliar. As a physician, she understood the implications of these signs, yet her mind struggled to fully accept them. The contrast between professional knowledge and personal denial created a dangerous hesitation, one that often delays critical medical action in moments of neurological emergency. The moment concern turned into immediate fear. The realization that something serious was unfolding came sharply when she recognized the combination of symptoms she was experiencing. Weakness, speech difficulty, imbalance, and sudden loss of coordination aligned with what she had spent years diagnosing in others. The question emerged with alarming clarity: could this be a stroke? Even with medical training, self-diagnosis in moments of crisis is rarely straightforward. The mind often resists worst-case interpretations, especially when they threaten identity and capability. She attempted to rationalize her condition, considering fatigue or temporary nerve issues, but the progression of symptoms made denial increasingly difficult. What made the situation even more striking was her awareness of how time-sensitive neurological events are. Every passing minute could lead to irreversible damage. Still, hesitation lingered, not from ignorance, but from the human tendency to reinterpret danger when it becomes personal. In such moments, knowledge alone is not always enough to prompt immediate action. Why awareness alone often fails in medical emergencies. Stroke awareness is widely taught, especially among medical professionals, yet real life recognition can still be surprisingly complicated. In many cases, symptoms do not appear in textbook form. Instead, they develop gradually or mimic less severe conditions such as fatigue, dehydration, or stress-related reactions. For women in particular, symptoms can present in less recognized ways, including nausea, restlessness, or generalized weakness rather than dramatic paralysis. This contributes to delays in seeking treatment, even among those trained to identify warning signs. In Dr. Lee's situation, the overlap between exhaustion from a demanding career and emerging neurological symptoms created a confusing internal conflict. Her professional training told her one possibility, while her lived experience suggested something less severe. This tension between logic and interpretation is a common barrier in emergency response. It illustrates how even highly educated individuals can struggle to act decisively when symptoms blur the boundary between ordinary discomfort and life-threatening conditions. A critical intervention that redirected the outcome, the turning point, came not from within her own judgment, but from someone observing her closely, her father. Also a physician, he immediately recognized the seriousness of her condition without hesitation or doubt. Unlike the internal conflict she experienced, his perspective was direct and urgent. He insisted she go to the emergency room immediately, overriding any attempts to minimize the situation. This external confirmation played a crucial role in breaking through the hesitation that had delayed action. In emergencies involving neurological symptoms, timely intervention is often the determining factor between recovery and long-term impairment. His insistence ensured that she reached medical care within a critical window. While she had the knowledge to recognize what might be happening, it was his decisive response that translated awareness into action. In many real-world cases, it is often this external push, someone else noticing what the individual cannot fully accept, that becomes life-saving. Diagnosis, confirmation, and the reality of brain injury at the hospital, imaging confirmed what had been feared: an ischemic stroke caused by a blood clot restricting oxygen flow to a portion of the brain. This type of stroke is particularly dangerous because brain cells begin to die within minutes when deprived of oxygen. The diagnoses brought both clarity and gravity to the situation. There was no reversing the immediate damage. The focus shifted entirely to preventing further injury and supporting recovery. Hearing the medical confirmation was emotionally overwhelming, even for someone accustomed to delivering difficult diagnoses. The phrase she later expressed, acknowledging that part of her brain had died, captured the stark reality of neurological injury. For someone whose career depended on fine motor skills, communication, and sustained concentration, the implications were profound. Every aspect of her professional identity suddenly felt vulnerable. What had once been routine abilities were now uncertain, dependent on recovery that could not be guaranteed. Identity, career pressure, and the weight of uncertainty, the impact of the stroke extended beyond physical health into the core of her identity. Her work required steady hands, precise movements, and confident communication with both patients and audiences. These were not secondary skills, but foundational elements of her career. The uncertainty surrounding her recovery introduced a new kind of fear, whether she would be able to continue doing the work that defined her professional life. Filming schedules halted, clinical procedures paused, and a highly structured routine was suddenly replaced with medical evaluations and rehabilitation. The contrast between her previous pace and her new limitations was difficult to process. For someone accustomed to control, the loss of control over her own body was particularly jarring. Yet this period also revealed how closely physical capability is tied to professional identity, especially in fields where skill is visibly demonstrated. The uncertainty became not just medical, but deeply personal. The foundations of a career built across generations to understand the magnitude of what she faced. It is important to look back at the origins of her journey. Her father's early medical work in Malaysia, where resources were limited and knowledge often came from a single reference book, laid the foundation for a family deeply connected to dermatology. His migration to the United States marked the continuation of that path, eventually influencing his daughter's career choice. However, her trajectory was not without setbacks. She initially faced rejection from dermatology training programs, forcing her to reconsider her direction before ultimately succeeding in entering the field. This persistence shaped her resilience long before fame arrived. The practice she eventually inherited from her father became both a continuation of legacy and a platform for innovation. Her story was not one of effortless ascent, but of repeated attempts, setbacks, and eventual alignment with a field she had been connected to since childhood. The digital rise that transformed medicine into media in 2010. She entered the digital space with a YouTube channel that initially attracted little attention. The content was simple, clinical, and unpolished. However, one video featuring a blackhead extraction unexpectedly gained viral traction. That moment changed everything. What had been a niche medical practice transformed into a global media phenomenon. Audiences were drawn to the combination of medical precision and visual curiosity, leading to exponential growth in viewership. Over time, her online identity expanded into television programming, skincare development, and mainstream recognition. The persona that emerged, widely known as Dr. Pimple Popper, became both a brand and a cultural reference point. Yet with rapid visibility came increased workload, constant production demands, and reduced downtime. The pace of growth, while successful externally, contributed to long-term strain that remained largely unnoticed until her body eventually forced a pause. Recovery, return, and the uneasy relationship with change recovery was gradual and physically demanding, marked by limitations in mobility, speech, and coordination. Simple tasks required conscious effort, and the sense of independence she once had was temporarily altered. For 2 months, she stepped away from surgery and filming, focusing entirely on rehabilitation. When she eventually returned to work, the environment that once felt routine now carried emotional weight. The clinic, the cameras, and the procedures all felt slightly different, as though viewed through a changed perspective. Although outwardly she resumed her career, internally there was an awareness that full restoration was not simply about physical recovery. Stroke leaves lasting imprints, both visible and subtle. Adjustments became part of daily life, including pacing, awareness of fatigue, and respect for bodily limits that had previously been overlooked. The return was not a reversal of events, but an adaptation to a new version of continuity. A final reflection on awareness, vulnerability, and survival today, she continues her work, though with a deeper awareness of fragility and health. The experience reshaped not only her approach to medicine, but also her understanding of personal limits. What once felt like invincibility within a demanding career was replaced with a more cautious perspective. She eventually chose to share her experience publicly, not for attention, but to emphasize the importance of recognizing early warning signs of stroke and not dismissing them. Her story highlights how easily symptoms can be misinterpreted, even by those trained to identify them. It also reflects how quickly life can shift when health is compromised without warning. While outwardly she appears to have resumed her previous role, the internal shift remains. The experience did not erase her career, but it permanently changed how she moves through it, carrying both caution and clarity, shaped by a moment when everything nearly stopped.